Autism, also known as autism spectrum disorder, ASD, is a complex neurodevelopmental condition characterized by a range of challenges related to social interaction, communication, and repetitive behaviors. It is called a spectrum disorder because it affects individuals differently, and the severity of symptoms can vary widely from person to person. Autism typically becomes evident in early childhood, and it lasts throughout a person's lifetime. Key characteristics and features of autism include social challenges. Individuals with autism often struggle with understanding and interpreting social cues. They may have difficulty making and maintaining eye contact, understanding nonverbal communication, such as facial expressions and body language, and forming relationships with peers. 1. Social challenges. Individuals with autism often struggle with understanding and interpreting social cues. They may have difficulty making and maintaining eye contact, understanding nonverbal communication, such as facial expressions and body language, and forming relationships with peers. Communication difficulties. Many individuals with autism have challenges in spoken and non-spoken communication. Some may have delayed speech development, limited vocabulary, or difficulty with expressive language. Others might struggle with understanding abstract language, humor, or sarcasm. 1. Repetitive behaviors. Repetitive behaviors or routines are common in individuals with autism. These can include repetitive hand movements, example, hand flapping, insistence on sameness in daily routines, intense interests in specific topics or objects, and repetitive use of language or phrases. Sensory sensitivities. Sensory sensitivities are common in autism. Individuals may be hypersensitive or hypersensitive to sensory stimuli like light, sound, touch, taste, or smell. Certain sensations that are tolerable to most people may be overwhelming or painful for someone with autism. 1. Strengths and differences. It's important to note that individuals with autism often have unique strengths and abilities. Some may excel in areas like mathematics, art, music, or memorization. The concept of neurodiversity emphasizes that these differences should be recognized and valued. 1. Diagnosis and assessment. Autism is typically diagnosed through a comprehensive evaluation by healthcare professionals, including developmental pediatricians, psychologists, or psychiatrists. The evaluation often involves observing the individual's behavior, conducting interviews with caregivers, and using standardized assessment tools. 1. Early intervention and treatment. Early intervention services, such as speech therapy, occupational therapy, and behavioral interventions like applied behavior analysis, ABA, can be highly beneficial for individuals with autism. These services aim to address specific challenges and promote development in key areas. 1. Lifelong journey. Autism is a lifelong condition, and the challenges and strengths associated with it may change over time. Many individuals with autism benefit from ongoing support and accommodations to help them lead fulfilling lives. We will meet in next video of autism myths and facts.